Hey class, it's Dr. Cross here. Today I'm going to be going over placement of an amalgam for a Class 2 amalgam restoration, and also a quick overview of some of the basic dental amalgam instruments that you should have in your armamentarium. Okay, you want to make sure you always have the amalgam well, articulating paper, amalgam carrier, football burnisher, cleoid discoid, carver. The round carver is especially helpful if there's decay in there. Explorer, ball burnisher. This one isn't absolutely necessary. It's kind of more of a personal preference. The T-ball burnisher with the beaver tail. Gingival trimmer, acorn burnisher. They have them in different sizes. Here's another larger size. Condenser, Hollenbach, mirror, Tafelmeyer and band, wedge, and floss. So I went ahead and already prepped this tooth that we're going to be working on, tooth number 5. We'll zoom in here for a bit. You can see here, going to be working on this one today. I already have the band already on the Tafelmeyer. We're going to go ahead and put that in there, followed by the wedge. On a live person, you might want to try to make sure you always put that wedge on the buccal, because they're going to be anesthetized. If you place it for the lingual, they're going to feel it more. All right. And the purpose of the wedge is to basically separate the teeth apart. Okay, so I'm going to pause for a moment while we mix the amalgam. Be right back. All right, so we finished mixing that amalgam. I like to use the smaller side of the amalgam carrier, and I like to always start on the inner proximal box first. I also don't like to do all bulk fill. I like to do it in increments. That way make sure that it's condensed properly. Because one thing about amalgam, if it's not condensed fully each step of the way, you run the chance of it just fracturing on you. Zoom in a little more here. That's about done with this part. All right, got it condensed quite a bit now. The next instrument I like to use is the ball burnisher. Kind of very gently removing any flash or any excess. Again, you don't want to add too much pressure right now. Okay, then I switch over to my acorn burnisher. You always want to make sure you lean it on the tooth. You want part of that on the incline of the cusps. See about giving you guys a little bit more light here so you guys can see. Okay, I hope that's a little better. And I like going with my Explorer ever so gently right around the marginal ridge. So now that it's starting to harden a bit more, you can start going in with your acorn burnisher. And you want the sides of that acorn leaning against the natural tooth, okay? Kind of go back again with the with the Explorer. Trying to give this a little bit more time to harden completely before I remove the Tafelmeyer. Because if you remove it too soon, you risk the amalgam crumbling and breaking off. I'm using the ball burnisher. Yeah, when you're hearing it kind of squeak like this, that means it's pretty much hardened already. So it's safe to go ahead and remove this. All right. So we're still not done yet. Now we go ahead and use our Hollenback and go in approximately with it, removing any flash. One final time with the acorn burnisher. You want to pass the floss through it, making sure that that's okay. Reposition here. Nice tight contact there. That's good. And then lastly, we're going to check the occlusion. Okay, we're going to check here. Have the patient tap, 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 tap. Nice. You never want to have any articulating paper marking right at the cable surface margin, right where the restoration meets the enamel. Okay. Occlusion looks good. That's it. Thanks for watching. Bye.